Please keep standing for the national anthem.
Sri Lanka Mata, Apa Sri Lanka, Namo 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 Mata. Sundara Sivarini, Surani Ati Sobhamana Lanka. Ranya Ganaya Mekamal Walaturu Diri Jaya Bhumiya Ranya. Apa Hatta Sapa Siri Seta Sadhana, Jivana Ye Mata. Pilihkanu Mena Apa Bhakti Puja, Namo Namo Mata. Apa Sri Lanka, Namo 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 Mata. Upame Apa Vidya, Upamaya Apa Satya, Upare Apa Shanti, Apa Hada Tula Bhakti, Upa Apa Aloke, Apa Ge Anuprane, Upa Apa Jivanale, Apa Muktiya Obale, Nava Jivana Devini, Nithina Apa Kubudu Karan Mata. ඥාන පීඩ වඩ වඳින රැගෙන යනු මැන ජය භූමි කරා. එක මවකගේ දරු කැළවැඩිනා, යමු යමු වී නොපමා. ප්‍රේම වඩා සැම වේද දුරලලා, නමෝ නමෝ මාතා. Apa Sri Lanka, Namo 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 Mata.
Cyclone Ditwa. As we all know, it resulted in a devastating nationwide emergency in Sri Lanka, affecting millions of people across all 25 districts. To honor and respect all those who lost their lives in Cyclone Ditwa, please observe a moment of silence. Thank you. Next in the agenda is the lighting of the oil lamp. I would like to invite the guest of honor, Professor Matthew Phillips, consultant in genitourinary medicine and HIV, honorary professor of genitourinary medicine and ethics, president, the British Association of Sexual Health and HIV. Please come forward, sir. The President of Sri Lanka College of Sexual Health and HIV Medicine, Dr. Shama Somawardana. Founder of the college, Dr. Iyanthi Abhayavikrama. Special invited guest, the WHO representative to Sri Lanka, Dr. Rajesh Pandav, WHO Regional Advisor for Hepatitis, HIV, STI, Dr. Paul Ling Chan, the Vice President of the College, Dr. Gayani Nanayakara, the President-elect of Sri Lanka College of Sexual Health and HIV Medicine, Dr. Nimali Jayasuriya, the immediate past President of the College, Dr. Priyantha Veerasinghe, the Secretary of the College, Dr. Vasanthi Hemamala, the Treasurer of the College, Dr. Nisansala Premaratna, the Editor-in-Chief of Sri Lanka College of Sexual Health and HIV Medicine, Dr. Manjula Rajapaksha, and representing the overseas faculty, Professor Graham P. Taylor. Thank you. Please take the seat. Now, I would like to invite Professor Matthew Phillips, the guest of honor, Dr. Shyama Somawardhana, the President of Sri Lanka College of Sexual Health and HIV Medicine, Dr. Rajesh Pandav, WHO representative to Sri Lanka, and Dr. Vasanthi Hemamala, the Secretary, to grace their presence at the head table. Now, Dr. Shyama Somawardhana, the President, Sri Lanka College of Sexual Health and HIV Medicine, will welcome you all. Over to you, Madam.
Good evening. Guest of honor, Professor Matthew Phillips, President of the British Association for Sexual Health and HIV. Special invited guest, Dr. Rajesh Pandav, WHO representative to Sri Lanka. Distinguished overseas guests, representatives from WHO, UNICEF, and international partner organizations. Distinguished invitees from the Minister of Health, past presidents, founder members, fellows, office bearers, council members, and members of the college. My dear teachers, colleagues, staff members, ladies and gentlemen. It is with great honor that I welcome you all to the inaugural ceremony of the 30th Annual Conference of the Sri Lanka College of Sexual Health and HIV Medicine, themed Translating Evidence into Action, Advancing Excellence in HIV/STI Prevention, Treatment and Care. Before we begin, I would like to take a moment to acknowledge the severe adverse weather conditions that have recently impacted our country. We mourn the precious lives that have been lost and hold in our hearts all those who have been injured or displaced. Our thoughts are with the families who are grieving and with the communities working tirelessly to rebuild after such devastation. Our chief guest, Dr. Anil Jasinghe, the Secretary of the Ministry of Health and Mass Media, had to cancel at the last minutes as he is required to visit the areas worst affected by the recent adverse weather. He has sent his best wishes to the college. I warmly welcome our guest of honor, Professor Matthew Phillips, President of the British Association for Sexual Health and HIV, United Kingdom. Thank you for your enthusiasm from the very first moment I contacted you, and I hope you enjoy your first visit to Sri Lanka. I extend my sincere appreciation to our special invited guest, Dr. Rajesh Pandau, WHO representative to Sri Lanka, for gracing this inaugural ceremony with your esteemed presence, and I also wish you every success in your new role. A heartfelt welcome is extended to the representatives from UNICEF, WHO, and our other valued international partners, whose continued collaboration and support has been instrumental in advancing sexual health and HIV medicine in Sri Lanka. I am honored to have with us distinguished guests from the Ministry of Health, whose guidance and partnership continue to strengthen our collective mission. A warm welcome is extended to Dr. Pauline Chan, WHO Regional Advisor, Hepatitis, HIV/STI at the Southeast Asia Regional Office, CRO. Professor Graham P. Taylor, Professor in Human Heterovirology, Imperial College London. Dr. Emily Clark, Consultant Physician in Genital Medicine and HIV in Liverpool, United Kingdom. Dr. Dilmini Mendis, Consultant in Sexual Health Medicine, Wellington, New Zealand. And all the distinguished members of our foreign faculty, and to all the distinguished members of the local faculty. An annual conference of this caliber would simply not be possible without your expertise, dedication, and generosity in sharing your knowledge. It is with deep respect that I acknowledge the presence of our past presidents, founder members, fellows of the college, council members, and all the members of the college. Your unwavering commitment and vision has shaped the legacy and impact of this institution over the past 3 decades. I am also pleased to welcome representatives from other professional colleges, colleagues, friends, and all distinguished guests who have joined us this evening. I extend a warm welcome to our respected sponsors whose support has made this event possible. Thank you for your valuable contribution and for partnering with us to promote academic growth. Ladies and gentlemen, thank you for being here today. Your presence adds immense value to this occasion and inspires us as we embark on another year of learning, collaboration, and progress. Thank you.
Thank you, Madam. Next, the President of College will introduce our distinguished guest of honor. Over to you, Madam.
Professor Matt Phillips. Professor Matthew Phillips is a consultant in genitourinary medicine at the North Cumbria Integrated Health NHS Foundation Trust and an honorary professor of genitourinary medicine and ethics at the University of Lancashire. Originally from Birmingham, he obtained his medical degree from the University of Manchester, a master's degree from Keele University, and an MD from Trinity College, Dublin. His medical training was completed across the northwest of England and Dublin. Throughout his career, he has maintained a strong focus on medical ethics, particularly its application to sexual health and HIV care. He currently serves on the BMJ Ethics Committee and is the president of the British Association for sexual health and HIV. In addition to his clinical and academic roles, he teaches medical, physician associate, and sexual health degree students. Thank you.
Well, good evening, everyone, and thank you very much for your kind introduction and invitation, Madam President. Esteemed guests, friends, and members of the College, it is my great honour to give this speech tonight as your guest of honour. But before I do speak of other matters, I would like to offer my prayers to those affected by the cyclone and its aftermath. My thoughts are with the families who have lost loved ones, and I pray for a rapid recovery of Sri Lanka. This is my first visit here, and I wish to thank my host for such perfect hospitality. I feel very welcomed, and I have found a new love of Sri Lankan food. I have been having Sinhalese lessons at home, but I'm not going to do it in the speech. Try me afterwards, please. That will be too much today. I thought long and hard about what I wanted to say to such a distinguished group, and as president of the British Association for Sexual Health and HIV, I thought carefully about the similarities between our organisations. We are different ages. BASH's original organisation was set up in 1922. Shortly after the government passed laws that made venereal diseases free of charge and confidential, which predates the NHS by at least 25 years. The college, of course, is younger and maybe a bit fresher than we are, as it began in 1995 with its precursor college. But I think that is where our differences end. The work we do every day supports the professional groups in one of the most stigmatised areas of medicine. Sex is fundamental to our existence and to human pleasure. All societies have views on the circumstances in which sex, and indeed sexual pleasure, is acceptable. This leads to stigma when those expectations are not met or different, and when that sex has not gone to plan, or when there are negative consequences. So the first and most important thing our organisations have in common is supporting professions in this branch of medicine, which is not only stigmatised by society, but sometimes within medicine itself. And in that way, both of our organisations are beacons to those we serve and to each other. Our organisations and every amazing person in them have in common the fact that they are brave. We collectively make our voices heard. We use our voices to give power to those who are otherwise voiceless, those who are unheard, or to those who are sometimes ignored. We must be brave when we advocate, or change will not happen. But we are brave, and in that we have things in common. It was a great honour to tour the national programme yesterday, and I extend my gratitude to those who showed me around. I was impressed by the range of services, but I was even more impressed by the people who clearly are proud of the work they do every day. I have some ideas I want to take back home with me about how to do things better, so thank you for that inspiring tour. It did make me think what we have in common is a great hunger. We are always working to get better testing, faster testing, better access for our patients, kinder world for our patients. And in that, we have a shared hunger for better things. I was humbled to see just how far this extends in Sri Lanka. As I flicked through the college's website, I saw that donations can be made to support patient care. Madam President, I observed to you yesterday what pride you must feel to lead an organisation that goes beyond education and beyond fellowship, and all the way to ensure that individual patients get the care that they need. We don't do that at BASH, as our care access is different. However, In a similar way, we do campaign relentlessly for more resources from our government to provide care to everyone who needs it, not just those who it is easy to treat, but those who we know most need our care. As I stand here as a guest at this wonderful conference, it is obvious that what we have in common is a push to improve standards of care, and indeed it is the title of this Congress. We examine, and it was a great pleasure to participate in your mock examinations this week. I think the future is bright by the quality of the candidates who are sitting it, and they should all be very proud, as should those who have taught them so well. We produce standards and guidelines for people to follow. We continue to create conferences for ourselves and for others so that they can be educated to provide ever better sexual health care. This is often done in addition to the day job. Madam President, it is no doubt the same for you as it is for me. We must first do our clinic and make sure everyone has been seen, and then turn to the duties of our colleges and organisations. But what we do have in common is an unquestionable commitment to excellent care for the people who we serve. That extends all the way to our daily interactions, educating our colleagues on why an HIV is crucial, saying over and over again, reminding people that syphilis is the great imitator. My final reflection on what we have in common is friendship, and I've left this towards the end, as it may be the most important. It is undeniable that when venereologists, or as we say, GU medicine, but I quite like venereologists, I might change my title, when they meet, they have shared stories. They will talk about the people they have served, but the people who they haven't yet served, but they would like to. They see who isn't getting care. They will share stories about interacting with other specialties, and everyone has a case where the answer was HIV or syphilis. But sadly, venereologists will also always have a story about how society has impacted on their patients, and that we have in common. So if we put these things together, what do we get? Well, for me, I believe we are the only specialty with a mandate for love. Not love with red roses, I mean a real love that makes us fierce and prepared to be brave to get access to whatever our patients need to lead their best lives. We have a mandate for a love that gives us the fire to work with stigma until it is tamed, and I do believe we can tame stigma. Colleagues and friends, never ever forget when it is difficult that it is our specialty, working alongside colleagues, that converted an HIV test as a fatal prognosis into a condition that is now able to be well managed and may in the near future diminish away. And that is our work. So if you accept my premise that we are in possession of this great power, the power of love, then I think what I would like to share with you is the 6 great challenges on my mind. I think we need to stay true to ourselves. We are trusted. Patients come to see us very distressed and upset. They tell us things that they can no longer bear to carry themselves and which they have told no one else. And there can be no greater privilege for us than to bear that trust. We must remember who we are and we must stay true. As venereologists, we are needed. The second great challenge, of course, is syphilis, and I've enjoyed many conversations, but for me, I think syphilis has changed. We're not seeing the syphilis in our textbooks. We're seeing a great range of presentations. We're seeing rates going up everywhere. Something's different. The great challenge is to re-observe our old enemy and work out how to beat it. The third challenge is the continuous push for research. HIV is an excellent case where research and funding has caused this condition to become controllable. However, for other conditions, this is not so. For syphilis, we still use blood tests from the early 20th century. Herpes has no cure in sight, and we all know how distressing that is for patients, how painful and upsetting. Research is slow or non-existent for some of the pillars of our work, whereas in others, such as human papillomavirus, where we have a vaccine, in parts of the UK we're talking about eradicating cervical cancer by 2040. So it can be done. We need all STIs addressing, and for that we need research. My fourth challenge is for us to continue to address stigma. I'm not sure any society can be stigma-free, but it can keep that stigma diminished. Stigma comes in many forms. Regardless of legal views, people live lives in groups, whether that is family or friends, and those are real lived experiences. Their fear of being judged can convert an easy-to-treat infection into a prolonged illness with long-lasting harm because they are afraid to see the literature they need to see. They're afraid to talk to people when they need care. We must continue to address stigma. My fifth challenge is to accelerate our one world thinking. The UK is a collection of islands. As an island state, it can think of itself as separate from the rest of the world. In 2022, we learned differently when we saw an infection that had previously been described as high mortality but limited spread in some African nations enter sexual networks, and suddenly monkeypox is being seen in clinics across the UK. We need to be operating on a one-world basis. Our specialty in particular gives us the context and the mandate to consider people's real lives. By taking a global perspective on sexual health, we begin to put that mandate to better use. And my final challenge, and that perhaps, Madam President, is a challenge between our organisations, is I would love us to talk more. As I have been here, I realise we are doing the same work. We're doing it with the same population groups, but in different settings and different contexts. How can we work together so that we can support each other and learn from each other? So, after those challenges, I would like to come to my closing remarks, my friends. I promise you that money changes, funding changes, and politics changes, but sex does not. It is the constant and perhaps most important driver of society. If all sex suddenly stopped today, there would be governmental level distress as there are no births in 9 months, and suddenly everyone would need to be having more sex. And that's not even thinking about the unhappy marriages. So sex is fundamental. As long as there are people having sex, there will be a need for us. I'm extremely proud to be a GU physician, and I hope you are too. As I conclude my speech, I wish to thank you again, Madam President, and the College for extending me the privilege of being your guest of honour at your 30th Congress.
Thank you, sir. As our distinguished chief guest, Dr. Anil Jasinghe, Secretary to the Ministry of Health and Mass Media, Sri Lanka, is not here with us today due to his work commitments as this disaster situation in the country. I would like to invite the President of the College to deliver the message from the chief guest.
Message from the chief guest, Dr. Anil Jasinghe, Secretary of the Ministry of Health and Mass Media. It is with sincere regret that I inform you that I am unable to attend your prestigious event owing to the national situation in the aftermath of the recent weather conditions. I extend my warmest felicitations to the President, Council and members of the Sri Lanka College of Sexual Health and HIV Medicine on the 30th annual conference of the College. This significant milestone is a testament to the college's sustained commitment to promoting sexual health, advancing scientific knowledge, and strengthening the national response to HIV and sexually transmitted infections. The theme of this year's conference, Translating Evidence into Action, Advancing Clinical Excellence in HIV/STI Prevention, Treatment and Care, aptly reflects the need to bridge research and practice to improve patient outcomes and enhance public health impact by transforming evidence into meaningful action. We can ensure that Sri Lanka continues to uphold high standards of clinical care while progressing toward the goal of ending AIDS by 2030. The Ministry of Health greatly values the long-standing partnership and technical leadership of the college in policy development, professional training, and service delivery. Your continued efforts are vital to achieving a healthier and more equitable future for all Sri Lankans. I extend my best wishes for a successful conference and for the continued growth and achievements of the Sri Lanka College of Sexual Health and HIV Medicine. Thank you.
Thank you, Madam. Now, I invite our President, Dr. Shyama Somawardhana, to introduce our special guest, Dr. Rajesh Pandav, the WHO representative to Sri Lanka.
Dr. Rajesh Pandav. Dr. Rajesh Pandav is a senior global public health leader with over 30 years experience in epidemiology, health policy, program management, and international health system strengthening. He will assume duties as the WHO representative to Sri Lanka. He assumed his duties as the WHO representative to Sri Lanka in December 2025. Prior to this, he served as the WHO representative to Timor-Leste 2015 to 2020 and to Nepal from 2020 to 2025. Dr. Pandav began his WHO career in 2004 at the Mental Health and Substance Abuse Unit of the WHO Regional Office for Southeast Asia. He has since served in several key positions, including Medical Officer, Public Health at the WHO Country Office for Maldives, and Health Policy Advisor in Timor-Leste. His distinguished service has earned multiple accolades, notably the WHO Director General's Excellence Award in 2017 and the Director General's Award for Excellence to WHO Timor-Leste for championing the Walk to Talk initiative. He also received the Director General's Award for Excellence for the Special Initiative on Mental Health in 2022. In 2023, he was honored with the Alumni Award for Practice by the Graduate School of Public Health, University of Pittsburgh, and was conferred the Order of Timor-Leste by President Jose Ramos Horta. Dr. Pandav has authored 27 peer-reviewed publications and several book chapters. Before joining WHO, he served as Senior Research Associate at the Western Psychiatric Institute and Clinic, University of Pittsburgh Medical Center. He holds an MBBS from Grant Medical College, Mumbai, and a Master of Public Health from the University of Pittsburgh, USA. Over to you, sir.
The guest of honor, Professor Matthew Phillips, President, the British Association for Sexual Health and HIV, President Dr. Shyama Somawardhana and the Council of the Sri Lankan College of Sexual Health and HIV Medicine, officials from Ministry of Health and Mass Media, Dr. Vasanta Hemamala, Secretary, Sri Lankan College of Sexual Health HIV Medicine, distinguished colleagues, partners and friends. Good evening, Ayubawan, Vanakkam and Assalamu Alaikum. It is a privilege to join you at the 30th annual academic sessions of the Sri Lanka College of Sexual Health and HIV Medicine, a landmark event that brings together clinicians, researchers, and public health professionals committed to advancing sexual health and HIV medicine in Sri Lanka. As we gather here today, Sri Lanka is facing significant challenges due to severe weather conditions that have disrupted lives and service. And my prayers and thoughts are the people who are affected by this. These events remind us of the importance of resilient health systems that can withstand emergencies while continuing essential services including HIV and STI care. This year's theme, Translating Evidence into Action, Advancing Excellence in HIV STI Prevention, Treatment and Care, perfectly reflects the essence of our collective mission. Evidence without action is knowledge without impact. The college has consistently demonstrated leadership in bridging this gap, ensuring that science informs practice and that care reaches those who need it most. I am pleased to note that Dr. Pauline Chan, WHO Regional Advisor for Hepatitis, HIV and STIs, is also attending these sessions to contribute to the technical discussions. Her expertise will enrich the dialogue on global and regional strategies for elimination. Sri Lanka is globally recognized for its strong public health system and achievements in its maternal and child health. In the domain of HIV and STIs, the country has made remarkable progress. Despite the unprecedented challenges posed by the COVID-19 pandemic and economic constraint, the country maintained its status of validation of elimination of mother-to-child transmission of HIV and syphilis since 2019, with the latest maintenance round into 2024. Hepatitis B control was achieved in 2023 with hepatitis B surface antigen prevalence less than 1% among 5-year-olds, a testament to sustained immunization coverage above 90% and throughout the pandemic. These milestones reflect the dedication of the Ministry of Health and Mass Media, the National STD AIDS Control Program, the Sri Lankan College of Sexual Health and HIV Medicine, and community partners. They also underscore the importance of integrated, resilient health systems. While these achievements are commendable, we must also recognize emerging challenges. HIV and STIs prevalence in Sri Lanka have shown an increase in recent years, particularly among young adult males under 25 years of age. This trend requires urgent and coordinated action to prevent further escalation. The recent weather events has further highlighted vulnerabilities in service delivery and access, particularly for marginalized populations. Therefore, integrating disaster preparedness into HIV and STI programs will be critical for sustaining progress and ensuring continuity of care during such crises. The next chapter in Sri Lanka's success story is triple elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B. WHO's global strategy envisions validation by 2030, and Sri Lanka is well positioned to achieve this ahead of schedule towards the well-being of mother and child and your next generation of young free of HIV, syphilis, and hepatitis B. So the key priorities include introducing universal hepatitis B screening as part of routine antenatal care and ensuring timely antiviral prophylaxis for eligible mothers and their infants. Strengthening HIV retesting policies in the third trimester and expanding partner and family testing. Enhancing laboratory quality assurance, including external quality assessment for HIV, early infant diagnosis, and viral load testing. Preventing stockouts of essential commodities and securing hepatitis B immunoglobulin prophylaxis for exposed infants. As well, there are also SDG 2030 targets of ending AIDS and elimination of hepatitis B and C as a public health problem. Would Sri Lanka be considering the WHO validation of elimination of hepatitis B and C? This means rethinking your vision for the future. This means convergence and integrated person-centered services. This means that all stakeholders, public, private, and community, need to pitch in efforts together to reach the most unreached. Long-term plans must also account for climate-related disruptions and emergencies. Building climate-resilient health systems and strengthening community networks will be essential to maintain momentum towards elimination goals. The Southeast Asia region has made significant strides, and Sri Lanka can lead by example, demonstrating that elimination is not just a target but an achievable reality. WHO at global, regional, and country level stands ready to support Sri Lanka through technical guidance on validation and integration frameworks, capacity building for clinicians and laboratory networks, advocacy for human rights, stigma reduction, and adolescent sexual health and reproductive health, mobilizing partnerships to ensure sustainable financing and innovation. The challenges we face are complex, ranging from behavioral and social factors to structural determinants, demanding that we all work together through multi-sectoral collaboration. As the country recovers both from the pandemic and the current weather-related challenges, let us reaffirm our commitment to integrating emergency preparedness into health strategies so that progress towards HIV, STI, and hepatitis elimination remains uninterrupted. I congratulate the college on your 30 years of leadership. This is indeed a momentous celebration. Let's reaffirm our shared commitment to science, solidarity, and service. Together, the college, the National STD and AIDS Control Program, WHO, and partners can make triple elimination a reality on the country. Thank you for your dedication and partnership. This is my only second day here as a WHO representative, so I'm sure I look forward to working with all of you for a healthier Sri Lanka. Thank you.
Thank you, sir. Ladies and gentlemen, the President of the Sri Lanka College of Sexual Health and HIV Medicine will now make the presidential address.
Guest of Honor, Professor Matthew Phillips, President of the British Association for Sexual Health and HIV. Special invited guest, Dr. Rajesh Pandau, WHO Representative to Sri Lanka. Distinguished overseas guests, representatives from WHO, UNICEF, and international partner organizations. Past presidents, founder members, fellows, office bearers, council members, and the members of the college. Distinguished invitees, my dear teachers, colleagues, staff members, ladies and gentlemen, good evening. It is indeed one of the happiest days of my life and a great honor to address you as the President of the Sri Lanka College of Sexual Health and HIV Medicine at this 30th annual conference. The theme for this year's conference and the focus of my address today is translating evidence into action, advancing excellence in HIV/STI prevention, treatment, and care. Over the next 20 minutes or so, I will take you through 4 key areas: recent advances in HIV and STI care, treatment and prevention, ending AIDS by 2030, Sri Lankan situation, the way forward for Sri Lanka. Let us begin with the global scientific landscape. Recent years, especially 2025, have witnessed exciting advances in HIV cure research. Among the most promising are the shock and kill and block and lock strategies, the use of broad neutralizing antibodies, and gene editing technologies. These are leading us closer to what once seemed impossible, a functional or even sterilizing cure for HIV. One landmark study enrolled young women from the PRESH cohort in South Africa. These women had started antiretroviral therapy early and maintained suppression for over a year. They received a combination of TLR7 agonist and 2 broadly neutralizing antibodies, followed by a carefully monitored treatment interruption. Remarkably, about 30% remained off ART for nearly a year, and some for even longer, showing that ART-free viral remission is achievable in real-world settings. Similarly, the RIO study in the United Kingdom and Denmark enrolled men who started ART soon after infection, received 2 broad neutralizing antibodies, and then paused therapy. Even at around 72 weeks, 39% of the antibody group maintained viral suppression, with some showing no detectable virus for over 2 years. These results suggest that when ART begins very early and is supported by immune interventions, sustained remission may be possible. Another exciting development is in long-acting therapy. A phase 2 study combined the capsid inhibitor lenacapavir with true bodily neutralizing antibodies, offering a twice-yearly regime for people already suppressed on ART. Although not a cure, this represents a major step forward in treatment convenience and adherence. On the frontier of science, CRISPR gene editing technology has shown impressive promise. Using CRISPR-Cas9 constructs targeting HIV's LTR regions, researchers achieved over 95% viral transcriptional suppression without off-target effects. Editing the viral genome or host factors may eventually allow us to silence HIV permanently. On the prevention front, we have seen equally transformative progress. The World Health Organization has now recommended lenacapavir as a twice-yearly injectable pre-exposure prophylaxis option. Similarly, cabotegravir administered every 2 months is already being rolled out in several regions. These long-acting PrEP options are game changers, addressing one of the biggest challenges in prevention, daily pill adherence and stigma. Turning to sexually transmitted infections, the story is just as encouraging. Gepotidacin, a first-in-class oral antibiotic for uncomplicated gonorrhea, achieved over 92% success in the phase 3 EAGLE-1 trial, proving non-inferior to current therapy. Given the growing threat of resistance to ceftriaxone and azithromycin, this single-dose oral option could be a global breakthrough. Another exciting intervention is doxycycline post-exposure prophylaxis for certain high-risk populations. Taking 200 milligrams of doxycycline after exposure reduces the risk of chlamydia by 65% and syphilis by 77%. For the first time, we have a biomedical prevention tool for bacterial STIs, a welcome complement to behavioral and screening approaches. In addition, the use of doxycycline as a potential pre-exposure prophylaxis for chlamydia and syphilis remains under active investigation. While the global community celebrates remarkable progress and innovation in the HIV-STI response, it is crucial for Sri Lanka to reflect on its own context and strategically align national efforts with the global goal of ending AIDS as a public health threat by 2030. According to UNAIDS, this means achieving a 90% reduction in new HIV infections and AIDS-related deaths compared to 2010 levels and zero stigma and discrimination. As of 2024, the global community has made remarkable progress. Together, their efforts have reduced new HIV infections by 40% and AIDS-related deaths by 56% since 2010. The world fast-tracked its commitment to ending AIDS by 2030 through the ambitious 95-95-95 targets, aiming for 95% of all people living with HIV to know their status, 95% of those diagnosed to receive treatment, and 95% of those on treatment to achieve viral suppression. At the end of 2024, approximately 87% of people living with HIV knew their status. Of those, 89% were receiving antiretroviral treatment, and 94% of the individuals on treatment have achieved viral suppression globally. Yet, even as we celebrate this progress, we must acknowledge the challenges that remain. In 2024 alone, the world saw 1.3 million new HIV infections, almost unchanged from the year before. This tells us that while treatment and care have advanced tremendously, gaps in HIV prevention still persist. To truly end AIDS by 2030, the world must close those gaps, reaching people who are most vulnerable, investing in prevention, and ensuring that no one is left behind. Ladies and gentlemen, allow me to take a moment to look back at the history of the HIV and STI response in Sri Lanka, how it began, how far we have come, and how close we are to reach the goal of ending AIDS by 2030. Since the first reported case of HIV in 1987, Sri Lanka has recorded a total of 6,528 HIV cases up to the end of 2024. Despite global, regional, and national challenges, our country continues to maintain one of the lowest HIV prevalence rates in South Asia, standing at less than 0.1% in 2024. One of our proudest national achievements was the elimination of mother-to-child transmission of HIV and congenital syphilis in 2019, a milestone we have successfully sustained to this day. By 2020, Sri Lanka was well on track toward achieving the UNAIDS global targets. We had achieved a 57% reduction in new HIV infections and a 56% reduction in AIDS-related deaths compared to the 2010 baseline. These achievements reflected the collective efforts of our government, health professionals, civil society, and communities living with and affected by HIV. However, just as the momentum was building, the COVID-19 pandemic struck, disrupting health systems worldwide. For Sri Lanka, as in many countries, the pandemic made it nearly impossible to carry out routine prevention, outreach, and community engagement activities, and much of the hard-earned progress in HIV prevention slowed. Adding to these challenges, the economic downturn in 2022 in Sri Lanka further constrained resources and hindered service delivery. These combined crises limited the reduction of HIV infection from 2010 baseline to 40% in 2024. In spite of these unprecedented challenges, Sri Lanka's HIV program remained steadfast, adapting, innovating, and continuing to provide life-saving services to those who needed them most. In 2024, Sri Lanka continued its progress towards ending AIDS and achieving the 95 targets. Among the estimated people living with HIV, 87% knew their HIV status. 81% of those who knew their status on antiretroviral therapy, and 90% of those on treatment were virally suppressed. However, as we look at the current situation, we see new challenges emerging. Data from 2020 to 2024 reveal a significant increase in HIV cases among men aged 15 years and above, rising from 295 cases in 2020 to 736 cases in 2024. In contrast, the number of cases among women and children has remained relatively stable. The predominant mode of transmission in Sri Lanka remains unprotected sexual contact. Over time, the pattern has shifted from mainly heterosexual transmission to a growing number of cases among men who have sex with men, particularly young MSM, who are now recognized as key drivers of the epidemic. In addition, we are witnessing a dramatic rise in bacterial sexually transmitted infections, particularly syphilis and gonorrhea among men. These two infections are often used as key indicators or proxy measures of recent unprotected sexual exposure. In 2024 alone, there were 512 cases of early or infectious syphilis reported among males, compared to 125 cases among females. Similarly, 875 men and 160 women were diagnosed with gonorrhea. These figures highlight a worrying trend and remind us of the ongoing need for prevention, testing, and awareness in our communities. So, ladies and gentlemen, are we going to sit back and watch as the silent epidemic of HIV and other sexually transmitted infections creeps upon us? Or are we going to rise to the challenge and strengthen our prevention, treatment, and care efforts? The choice is ours, and the time for action is now. I would like to propose several key actions related to HIV/STI prevention and treatment that can advance excellence in Sri Lanka's national response to HIV and support our shared goal of ending AIDS by 2030. Sri Lanka's HIV epidemic still remains largely concentrated among key populations. According to available data, over the years, the National STD/AIDS Control Program with the relevant partner organizations has implemented a range of behavioral and biomedical interventions to prevent HIVs and STI, including condom promotion, PrEP, and Pepsi, targeted to key populations such as men who have sex with men, female sex workers, transgender persons, and people who inject drugs. According to the 2022 External Review and the Transition Readiness Assessment Report, one of the long-standing challenges in HIV prevention among key populations in Sri Lanka is limited coverage. Data reported by Sri Lanka in 2019 based on the Integrated Biological Behavioral Surveillance results show that coverage was only 25% among female sex workers, 19% among men who have sex with men, 21% among people who inject drugs, and 29% among transgender women. These figures highlight significant gaps in reaching those most vulnerable to HIV. Furthermore, it was revealed that a large proportion of key populations remain hidden or unreachable. Around 70% of female sex workers, 65% of men who have sex with men, and about 45% across all key population groups. This means that many individuals at highest risk are still beyond the reach of essential prevention and care services. To overcome these challenges, we first need to conduct a thorough situation analysis to better understand the key drivers of the epidemic. We must explore why transmission is on the rise. Is it due to an expanding MSM population, or are we simply detecting more cases through increased testing? Could it be a decline in condom use, a rise in high-risk behaviors associated with chemsex, or the low uptake of PrEP? Perhaps it's even a growing sense of complacency among young people, driven by a romanticizing of the undetectable equals untransmissible message. We also need to look closely at the percentage of bisexual men within the MSM community, as they form a bridge population linking high-risk and low-risk groups, including women, which can threaten the EMTCT status of the country. Identifying these underlying factors is crucial in shaping an effective and targeted response. Within the MSM population, it is important to determine whether the majority of newly infected individuals are being already reached by our prevention programs, or whether they belong to hidden groups that remain outside these networks. At present, a significant proportion of new infections are found among hidden or unreached MSM. Therefore, we must intensify broader communication efforts to reach those who remain beyond the scope of traditional prevention programs, a matter that I will elaborate on shortly. Updating and implementing the National Communication Strategy on HIV/STIs is a must for Sri Lanka, especially to reach the hidden key populations, the drivers of the HIV and STI epidemics in the country. The National Communication Strategy should focus on 4 key areas: prevention, diagnosis, treatment and care, and creating a supportive environment. The strategy should use the mass media, social media, and community-based communication to promote safer sexual practices, encourage condom use, and increase HIV testing. The aim is to normalize HIV testing, dispel myths, and break the stigma surrounding HIV and other STIs. At the same time, it will raise public awareness about the services available through STD clinics, NGOs, and other partners, that no one is left behind due to lack of information or fear. Thirdly, deeply entrenched stigma is a key factor behind why many members of the key populations remain hidden or unreachable, and this has long been acknowledged as a major barrier to the provision of HIV/STI services for key populations in Sri Lanka. The combined effects of stigma and discrimination related to both HIV and key population status have far-reaching consequences. They influence how individuals seek health care, perceive their own risk, and engage in risk behaviors. As a result, it directly hinders their willingness and ability to access essential HIV and STI services, including those focused on prevention. That is why achieving zero stigma and zero discrimination is not just an aspiration, it is a necessity if we are to end AIDS by 2030. When people can access health care without fear of judgment or rejection, when they are treated with dignity and respect, and when every voice is valued, only then can our prevention, treatment, and care efforts truly reach everyone in need, ending stigma is therefore at the heart of ending AIDS. Fourthly, while I have spoken about the recent advances in HIV and STI treatment and care and prevention, we must remember that Sri Lanka is a middle-income country with a fragile economy. Therefore, we need to manage our HIV and STI response effectively without placing additional strain on our health budget, something we have successfully achieved so far. To sustain this progress, it is essential that we preserve the effectiveness of the antiretroviral and STI drugs currently available in the country. Sri Lanka is already facing a growing challenge of antimicrobial resistance, largely due to the misuse and overuse of antibiotics in other clinical settings. If we are not vigilant, a similar situation could emerge within the HIV and STI response, undermining years of hard-earned progress. Our most recent pre-treatment drug resistance survey conducted in 2021 showed low-level resistance with mutations detected in only 10% of patients starting ART. To maintain this low level of pre-treatment drug resistance, it is essential that ART for people living with HIV and for pre-exposure prophylaxis be prescribed in accordance with national guidelines, accompanied by close monitoring of ART adherence and effective default tracing. Therefore, it is strongly recommended that ART prescriptions remain strictly within the purview of the National STD AIDS Control Program. If this is not maintained, we risk facing a pre-drug resistant HIV epidemic, a situation we cannot afford to let happen. Distinguished guests, colleagues and friends, in closing, I would like to emphasize that Sri Lanka's HIV and STI response is built upon strong foundations, a robust public health infrastructure, free universal access to healthcare, high literacy and health awareness, firm political commitment and policy support, and active community engagement at all levels. Let us continue to work together, clinicians, policymakers, community leaders, and young people, to ensure that every discovery, every breakthrough, and every intervention reaches those who need it most by translating evidence into equitable, timely, and compassionate action. Together, we can make excellence in HIV and STI prevention, treatment, and care not just a theme, but a reality for all Sri Lankans. Before I conclude, I would like to express my heartfelt gratitude to my late father, my mother, my husband Krishanta, my son Jayan, for their tremendous support throughout my journey. I also wish to extend my sincere appreciation to Dr. G. Veerasinghe, my supervisor during the postgraduate training, and all my teachers, colleagues, and dear friends for their guidance, encouragement, and kindness. My special thanks goes to Dr. Lilani Rajapaksha, Dr. K. M. Mariratna, Dr. Manjula Rajapaksha, and Dr. Anuruddha Karunaratna for their inputs for the speech. Lastly, I would like to invite you all to join us for our main conference over the next 2 days, where we will share knowledge and experiences with both local and international experts. Thank you.
Thank you, Madam. This year, the Council has decided to award fellowships to 2 distinguished personalities who has contributed immensely for the development and enhancement in the field of venereology. Now, I would like to invite Dr. Manjula Rajapaksha to read the citation for Dr. Gayani Nanayakar.
Good evening, everybody. Dear President and Council, members and honorary fellows of the Sri Lanka College of Sexual Health and HIV Medicine, guest of honor, Professor Matthew Phillips, President of the British Association of Sexual Health and HIV, and special guest, Dr. Rajesh Pandau, WHO representative to Sri Lanka, and all distinguished invitees. I have great pleasure in proposing my colleague, Dr. Gayani Nanayakara, whose silent yet invaluable service has strengthened the field of venereology in Sri Lanka, for the award of the fellowship of the Sri Lanka College of Sexual Health and HIV Medicine for the year 2025. Gaini is the youngest daughter of Mr. and Mrs. G.A.M. Nanayakkara, who are also blessed with 3 siblings. She completed her school education from Southlands College, Galle, and graduated from the Faculty of Medicine, University of Ruhuna in 1997. Following completion of internship at National Hospital Sri Lanka and the Castle Street Hospital for Women, she returned to her hometown with the post-intern appointment as a medical officer in anesthesia at Teaching Hospital Karapitiya, where she served as a cardiothoracic anesthetist and medical officer ICU for 5 years. While working as an anesthetist, she decided her career in a totally different field, that is venereology, where she actually changed the direction from the head end of the patient to the foot end. She completed diploma in venereology at the Postgraduate Institute of Medicine, University of Colombo in 2007 and completed the MD in venereology in 2010. After completion of her post-MD local training, she proceeded to the specialized overseas training on HIV and GU medicine in Guy's and St. Thomas's Hospital NHS Foundation Trust, London, United Kingdom, and obtained further working experience in GU and HIV medicine at St. Mary's Hospital, Imperial College NHS Trust, and Northwick Park Hospital in London, Northwest Healthcare Trust. Upon returning from overseas training, she commenced working as a consultant venereologist in Sri Lanka and had worked in STD clinics Matara, Avisavela, and Ratnapura. Out of the 27 years of her service as a medical professional in Sri Lanka, she had dedicated 22 years to the field of venereology. Currently, she is a board-certified consultant venereologist at District General Hospital, Avisavela. She is a trainer, supervisor, and examiner for the postgraduate diploma and MD in venereology, and she is a member of the Board of Study in venereology and involved in many academic activities, including development of diploma and NB prospectus in venereology. She was a member of the Research Proposal Reviewing Committee, RPRC, of the Board of Study. She is doing a great job as the course coordinator of diploma in venereology since 2022 up to now. She has been intimately involved in teaching medical undergraduates, postgraduates, and allied health students. She has been involved in several researches and publications nationally and internationally. She also has given her contributions to develop many national guidelines, including antiretroviral treatment guideline, opportunistic infection management guideline, STI management guidelines, national HIV testing guideline, EMTCT guideline, and many more. She has been a council member and member of the editorial board since 2018. Currently, she holds the post of the Vice President of Sri Lanka College of Sexual Health and HIV Medicine for the year 2025. On a personal note, I have known Gaini for many years as a trustworthy colleague and obviously a friend who is in need. I identify her as a courageous mother who is fortunate to have 2 great sons, Tavisha and Rasula, who headed to the University of Colombo and continue to make her proud through their academic pursuits. Madam President, in a recognition of her invaluable contribution to the specialty and to the college, it is my immense pleasure to present Dr. Gaini Nanayakkara for the conferment of the Fellowship of the Sri Lanka College of Sexual Health and HIV Medicine this year. Thank you.
Next, I would like to invite Dr. Nimali Jayasuriya to read the citation for Dr. Priyantha Veerasinghe.
Good evening, the President and the Council, members and honorary fellows of Sri Lanka College of Sexual Health and HIV Medicine, guest of honor, Professor Matthew Phillips, consultant GU Medicine and HIV in Cumbria, UK, President of British Association of Sexual Health and HIV. Special invited guest, Dr. Rajesh Pandav, WHO representative to Sri Lanka, and distinguished invitees. It's with great honor and heartfelt admiration that we recognize Dr. Don Priyantakumara Veerasinghe, an exemplary clinician, educator, scholar, and visionary leader in the field of sexual health and HIV medicine. His distinguished career reflects an unwavering commitment to improving the lives of individuals and communities affected by STIs and HIV in Sri Lanka. Dr. Veerasinghe was born in 1974 as the youngest child of Mrs. Vimala Veerasinghe and late Mr. Walter Veerasinghe. He began his schooling at Sri Dharmaloka Central College in Kelaniya and later entered the prestigious Royal College, Colombo. He graduated from the Faculty of University Colombo in 2000 with second-class honours and completed his internship at Teaching Hospital, Colombo North. He subsequently served as Senior House Officer in Obstetrics and Gynecology and as a Medical Officer in Ophthalmology. So after that, actually, he dedicating himself to the specialty of venereology. He obtained the postgraduate diploma venereology in 2010 and MD venereology in 2013 from the Postgraduate Institute of Medicine, University of Colombo. For his overseas training, Dr. Veerasinghe proceeded to the United Kingdom, where he gained advanced experience in sexual health and HIV medicine at St. Mary's Community Hospital under Dr. Veerakethi Harendra. He further broadened his expertise in contraception, menopause management, and reproductive health at St. Mary's and Queen's Alexandra Hospital, Portsmouth. During this period, he completed diploma, DFSHRH, and certification in menopausal care, as well as the letters of competency in subdermal implant insertion and intrauterine techniques from the Faculty of Sexual and Reproductive Health, UK. Dr. Veerasinghe has been board certified consultant venereologist of Postgraduate Institute of Medicine since 2014, serving the Ministry of Health, Sri Lanka. He has led sexual health clinics in Chilau, Gampa, and Negombo, and played a pivotal role in establishing the new building at STD Clinic, Gampa. Over the past 8 years, he has made significant contributors towards STI and HIV prevention and control activities in the Gampa district. He is a life member of Sri Lanka College of Sexual Health and HIV Medicine, where he has held key positions including council member, treasurer, president-elect, and the president. As president of the college in 2024, Dr. Veerasinghe championed collaborative efforts with multiple professional colleges to strengthen services for individuals with sexual health needs and the people living with HIV. His presidential theme, Let Science Reach All, reflected his commitment to equitable access to modern scientific advances. He initiated the college's preparatory course for the diploma in venereology and oversaw the completion of the basic textbook in venereology for new postgraduate trainees. Dr. Veerasinghe has contributed extensively to national policy and guideline development. He has been a key contributor to National HIV Care Management Guidelines, National ART Guidelines, National STI Care Guidelines, Clinical Practice Guideline for PrEP, and SOP for monkeypox. He presented college on multiple expert committees within the Ministry of Health, offering his expertise on national strategic decisions. His MD dissertation focused on disease-specific quality of life and treatment outcomes among patients with genital warts, where he heavily studied about the subject of genital HPV and associated factors in Sri Lankan context. His continuing research interest includes syphilis epidemiology, advanced HIV care, clinical manifestations of syphilis. He is currently engaged in research on demographic trends and treatment response among individuals presenting with syphilis to sexual health clinics. He also serves on the editorial board of Sri Lanka College of Sexual Health and HIV Medicine. At present, Dr. Veerasinghe serves as consultant venereologist at Sexual Health Clinic, Negombo. He's a dedicated educator, certified trainer, and visiting lecturer at the Postgraduate Institute of Medicine. He has served as an examiner for the postgraduate diploma and MD venereology examination and was the chief examiner for the diploma in venereology for past 2 years. He has coordinated numerous training programs for postgraduate trainees and for medical officers, public health inspectors, and medical laboratory technologists. Beyond medicine, Dr. Veer Singh is a man of creativity and reflection. He possesses a lifelong passion for creative writing, having won several short story competitions during his university life. He aspires to publish his first collection of stories in near future. He is supported in all his achievements by his wife Inoka, and he is a devoted father to his 2 sons, Senula and Sesat, who remain his greatest source of pride and inspiration. Today, as we honor Dr. Veer Singh with this fellowship, we celebrate not only an outstanding clinician and academic, but a leader whose dedication has elevated sexual health services and strengthened HIV care in Sri Lanka. Madam President, ladies and gentlemen, in recognition of his sustained contribution to the specialty and the college, I am greatly privileged to present Dr. Don Priyantha Kumar Veerasinghe for conferring esteemed fellowship of the Sri Lanka College of HIV and HIV Medicine.
I request Dr. Priyantha Veerasinghe and the President to remain on the stage for the next item in line, which is the awarding of the immediate past President for the year 2024. May I now invite the President to award the medal to Dr. Priyantha Veerasinghe. Thank you, Madam. Now, I would like to invite the President to remain on stage to award the following medals. Dr. Lushan Jayasuriya and Mrs. Jayasuriya have been awarding a gold medal for the best performance at the postgraduate diploma in venereology examination since year 2003. The recipient of the medal for the year 2025 is Dr. Sandun Rajapaksha. Please extend a round of another applause to Dr. Sandun for his commendable achievement. The gold medal for the best performance at MD Venereology examination has been awarded by Dr. Iyanthi Abhayavikrama since year 2014. The recipient of the medal for the year 2025 is Dr. Masna Iqbal. Please extend a warm round of applause to Dr. Masna for her commendable achievement. Thank you, Madam. Now, we are heading for a special moment. It is the time to acknowledge the dedication, contribution, support, and hard work carried out to strengthen the field of venereology. I would like to take this valuable opportunity to invite Dr. Geethani Samaravira to read the citation for Dr. Jayadari Ranatunga. Over to you, Madam.
Thank you. President and the Council, members and the fellows of the Sri Lanka College of Sexual Health and HIV Medicine, guest of honor, Professor Matthew Phillips, Consultant Gender Medicine and HIV in Cumbria, UK, President of the British Association of Sexual Health and HIV, special guest, Dr. Rajesh Pandav, WHO representative to Sri Lanka, ladies and gentlemen. It's my honor to present this citation in recognition of the distinguished service and the exemplary career of Dr. Jayadari Deeptika Ranatunga. Dr. Ranatunga was born on 27th of April 1962. She received her primary education at Gaspar Kanishta Vidyalaya and her secondary education at Devi Balika Vidyalaya, Colombo, where she successfully completed her advanced level examination in 1978. In 1979, she entered the Faculty of Medicine, University of Colombo, and graduated with her MBBS degree in 1985. She has served the Sri Lankan health sector for 4 decades, beginning her journey as the medical officer at Teaching Hospital Ragama and culminating at the highest respect consultant venereologist at the same station as at the STD clinic Ragama. Her commitment to professional development is remarkable. She obtained the diploma in family medicine in 1998, the diploma in venereology in 2003, and MD in venereology in 2006. The first batch of venereologists came through this new stream from the Postgraduate Institute of Medicine, University of Colombo, Sri Lanka. She underwent advanced training in sexual health at the Sexual Health Clinic in Adelaide, South Australia, and received additional international training on counselling and HIV care in Thailand. She was board certified as a consultant venereologist in 2008. Dr. Ranatunga first served as a consultant venereologist at STD Clinic Kalubovila before taking up duties at the STD Clinic Teaching Hospital Ragama, Sri Lanka. It's the second highest, largest HIV clinic in the country. From 2009 until her retirement in 2025, she served this institution with excellent commitment, dedication, and integrity. During her 16 years of service in STD Clinic Ragama, she trained countless medical students, postgraduate trainees, and other healthcare staff. She was deeply respected for her gentle manner, her unwavering commitment to patient care, and her steady professionalism. Even in the most challenging time in her personal life, she never faltered in her duties as a clinician, a teacher, a supervisor, and a supportive colleague. Her service to the profession extends far beyond the clinical practice. She has been a pillar of the College of the Venereologists in Sri Lanka since its very early years, serving as the council member from 2003, secretary in 2003 and 2004, and president in 2012 and 2013. She has been the constant presence in the academic sessions of the Sri Lanka College of Sexual Health and HIV Medicine, generously sharing her expertise and strengthening the academic foundation of the college. Dr. Ranatunga also made important contribution to research in sexually transmitted infections. She supervised numerous publications and served several MD dissertations, shaping the generation of specialists. She has served as a member of the Board of Study in Venereology in 2012, and she has been an examiner for both diploma and MD in Venereology for many years. She also served as the chief examiner for the MD Venereology from 2004 up to date. Born to Mr. and Mrs. Ranatunga, she was married to late Dr. Gamini Gunawardana. She is a devoted mother of Semini Saubhagya Gunawardana, manager quality at ACE Pharmaceuticals, and Senura Gunawardana, product specialist and marketing manager at Pershaw, Brunei. In her personal life, she enjoys reading on Buddhism and literature and seeks to live a simple, meaningful life. On a personal note, Dr. Ranatunga has been a treasured friend and esteemed senior colleague. Her gentle strength, humanity, and profound commitment have guided and encouraged me personally as well as many other junior venereologists. I feel truly honored to succeed her as the consultant venereologist at STD Clinic Ragama and to carry forward the high standards she established with such dignity. Ladies and gentlemen, I would like to present, it's a great respect and admiration that we present this tribute to Dr. Jadari Deeptika Ranatunga on the occasion of her retirement. Madam President, over to you.
Thank you, Madam. Now, Dr. Vasanthi Hemamala, the Secretary of the College, will propose the vote of thanks. Over to you.
Good evening, distinguished guests, ladies and gentlemen. As the Secretary of Sri Lanka College of Sexual Health and HIV Medicine, it is indeed my great honor and privilege to stand before you this evening to deliver the vote of thanks at the inauguration ceremony of our 30th Annual Conference 2025. Before I begin my formal acknowledgement, I wish to speak from my heart. Sri Lanka is going through one of the most tragic moments in recent history. Over the past days, devastating floods and earthslides have claimed many of precious lives, and thousands of our fellow citizens have been displaced, losing their homes, livelihood, and the sense of security. Tonight, as we gather here in unity and fellowship, our hearts remain with all those affected by this unimaginable tragedy. As Sri Lankan, we stand together as one family in time of sorrow and resilience. I humbly thank each of you for being here despite this national crisis and for your solidarity with our people. So, first and foremost, I wish to extend our deepest gratitude to the eminent individuals who have graced this special occasion with their presence. Our guest of honor, Professor Matthew Phillips, the President of the British Association for Sexual Health and HIV, and our special guest, Rajesh Pandey, WHO representative to Sri Lanka. We are truly privileged to have you with us tonight. Your presence brings great prestige to this event and inspires us in our collective effort to advance sexual health and HIV medicine in Sri Lanka. I also express our heartfelt appreciation to our distinguished foreign delegates, Professor Taylor, Dr. Emily Clark, Dr. Pauline Chang, and Dr. Dilmini Mendis, who have traveled from across the globe to join us. Your presence has greatly enriched this conference. Our gratitude also extends to all international speakers who join us virtually, Associate Professor Carol Koh, Dr. Ranjababu Kulasegaram, Dr. David Barlow, Dr. Daru Solsaina, and Dr. Mahesh Ratnayaka. And to our esteemed local speakers, Professor Tashi Chang, Dr. Amila Chandrakumara, Professor Chathuru Suravira, Dr. Udita Bulagahapitiya, Dr. Kapila Ranasinghe, Dr. Yasa Sabbe Vikrama, Dr. Kapila Bandhu Tilaka, Dr. Indira Kahavita, Dr. Gaina Nayakara, Dr. Geetani Samaravira, Dr. Darshani Vijay Vikrama, and Dr. Inoka Munasinghe. Thank you for delivering valuable and inspiring lectures. Without your contribution, this event would not have been a reality. I sincerely thank to WHO and UNICEF for the support extended in organizing Symposium 1 and 4. My gratitude goes to Dr. Samira Hevage and Dr. Dhammika Roy for their fullest cooperation. My heartfelt appreciation is extended to our judges for the pre-paper sessions and poster presentation. Professor Dulani Samaranayaka, Professor Mahika Senevi Vikrama, Professor Anuradhini Kasturiratna, Dr. Ishanka Talagala, Dr. Lilani Rajapaksha, and Dr. Ari Ratna Manatunga for your invaluable service. I also wish to thank all our sessions chairperson for their commitment. Special thanks to Dr. Manohari Senevi Ratna and Dr. M.I. Mujahid, Consultant Physician, National Hospital Sri Lanka, for your support in successfully organizing the mock exam for our MD candidates. A heartfelt appreciation is owed to Dr. and Mrs. Lushan Jayasuriya and Dr. Yanti Abe Vikrama for their continuous encouragement to postgraduate trainees by awarding medals for the best performance at the Diploma and MD examination. We also wish good health to Dr. Lushan Jayasuriya, the founder president of our college. My sincere thanks go to Director of National STD and AIDS Control Program, Dr. J.C.M. Tennakon, for her unwavering support. I extended my special thanks to all consultants of NSACP and Ragam STD Clinic, Dr. Nimal Jayasuriya, Dr. Ari Ratna Manatunga, Dr. Geethani Samaravira, Dr. Jayadri Ranatunga, Dr. Iruka Rajapaksha, Dr. Prageet Premadasa, Dr. Varuni Pannala, Dr. Vinod Dharmakulu Singh, Dr. Umeda Jayasinghe for your constant support and for enabling me to carry the college responsibilities. My heartfelt gratitude goes to Dr. Manjula Rajapaksha, whose exceptional leadership as editor-in-chief has elevated the journey of sexual health and HIV medicine to new heights. Thank you for your guidance and encouragement. A special thank you to Dr. Nalakabe Gunasekara and Dr. Ajit Karavita for your constant availability and expert advice. Words are not enough to express our appreciation. Dr. Nimal Jayasuriya, Coordinator STI Care Service and EMTCT Program, thank you for your tireless support in making this event a success. Dr. Anuruddha Karunaratna, your contribution to the conference proceeding and the pre-congress arrangement have been truly invaluable. We are deeply grateful for your unwavering dedication, guidance, and mentorship. Thank you for supporting us with such generosity and commitment. Ladies and gentlemen, an event of this magnitude represents a month of meticulous planning, teamwork, and dedication. I am profoundly grateful to our President, Dr. Shama Somawardana, for her visionary leadership, unwavering support, and constant encouragement. Her approachable, friendly nature and genuine care for each of us have created a truly inspiring and supportive environment throughout this journey. My sincere thanks goes to Council of 2025 for their enthusiasm and commitment. Dr. Gayani Nanayakkara, Dr. Nimal Jayasuriya, Dr. Manjula Rajapaksha, Dr. Lilani Rajapaksha, Dr. G. Veerasinghe, Dr. Ari Ratna Manatunga, Dr. Ajit Karavita, Dr. Darshani Vijay Vikrama, Dr. Jayadri Ranatunga, Dr. Priyanth Veerasinghe, Dr. Geethani Samaravira, Dr. Chitran Haturusinghe, Dr. Nalaka Abbe Gunasekara, Dr. Iruka Rajapaksa, Dr. Prageet Premadasa, Dr. Varuni Pannalan, Dr. Kokilanthi Dharmaratna. To our consultant, Dr. Piyomi Pereira, Dr. Krishanthi Ubbesekara, Dr. Chaturika Vikramaratna, Dr. Damidu Tantri, Dr. Champika Gunawardhanan, Dr. Kanchana Veerasinghe, and Dr. Rahul Fernando, thank you for your support. Special appreciation goes to Dr. Lilani Rajapaksha and Dr. G. Veerasinghe, who continue to support the college even after retirement. Your enduring commitment, generosity of spirit, and unwavering dedication are truly inspiring, and we remain deeply grateful for your continued guidance. My heartfelt thanks to Dr. Hemantha Veerasinghe, MOIC, National STD Clinic, for your continued support. I also extend my heartfelt thanks to Dr. Nishan Gunaratna and Dr. Nalaka Kulatunga for their dedication, guidance, and ever-willing support, and Dr. Lalantika Velaviti and Dr. Irani Gunatilaka for their valuable cooperation. To Dr. Dulipan Adira, Dr. Udari, Dr. Chani, and Dr. Sharmila, Dr. Kumari, though you were away from the country, your encouragement meant a lot to us. I sincerely thank my hardworking Assistant Secretary, Dr. Dilanka Nimalaratna, and Dr. Masna Iqbal, and our Treasurer, Dr. Nisansala Premaratna, for managing our financial matters with such efficiency, transparency, and dedication. Your tireless efforts, attention to detail, and dependable support have been invaluable to the smooth functioning of our activities, and I am deeply grateful for your outstanding contribution. To Dr. Niloka Madrasinghe, Dr. Roshan Javed, and Dr. Sitmi Koswat, thank you for your immense support and encouragement. I extend my best wishes to Dr. Nisansala, Dr. Sarani, Dr. Neelu, Dr. Geet, Dr. Thanuja, and Dr. Nadik for your upcoming MD examination. We are proud of you. A special note of gratitude goes to Dr. Sandun for your invaluable support in technical and IT works. Dr. Tharushi, Dr. Oshadi, Dr. Dilija, Dr. Natasha, extend our heartfelt appreciation for your excellent comparing and the elegance of you brought to these sessions. To my dear colleague, Dr. Dinosha, Dr. Nishanti, Dr. Madhavi, Dr. Oshadi, Dr. Sasanka, Dr. Dilija, Dr. Praveen, and Dr. Jamal, thank you for standing by me and lending your hands whenever needed. My heartfelt thanks go to Dr. Menosha, Dr. Dimagi, Dr. Manchula, Dr. Chanudini, Dr. Ruvini, Dr. Randi, Dr. Indra Chapa. Your support has been my greatest strength. Special thank you to all the medical officers and staff of the NSACP for your assistance throughout this event. Ms. Fasmia, your hard work was instrumental in the success of this event. Thank you very much. I express my sincere gratitude to our valued donors and sponsors. Our Diamond sponsor, Education Grant from Glided Science, special support from Ministry of Health, WHO and UNICEF. Gold sponsors are Johnson & Johnson, Sunshine Healthcare, George Stewart. Silver sponsors, Bayers, John Keels Properties, FPA. Bronze sponsors, Ferrosans Laboratories, Principal Healthcare, Vita Biotics, Biogen, Management. Other valuable sponsors, Bank of Ceylon, Newgen Lanka Healthcare, Vision Care Optical Service, Emma Pharma, Active Man, Canon Medicare, Biogenic Pharma, Viable Diagnostic, Bago Laboratories, and Treatwell. Heartfelt thank you to you to each of you. My sincere appreciation also goes to the management and staff of Hilton Colombo, to Mr. Shamal Hevage, our event organizer, to Mr. Dinesh, our long-standing photographer, and to the Tilina Gayan Dancing Studio for adding color and blessing to tonight's ceremony. One personal note, I extend my deepest appreciation to my husband, children, and parents for their patience and unwavering support. And I also thank the families of all our college members whose quiet sacrifice strengthened us throughout this challenging time. Before I conclude, I wish to make a humble appeal to WHO, UNICEF, and our esteemed foreign delegate. Sri Lanka needs your friendship now more than ever. As our people struggle to recover from floods and landslide, we earnestly seek your support to help us rebuild our community, restore hope, and heal our nation. If I have unintentionally mentioning anyone, please accept my sincere apologies. For every small mistake, I take full responsibility, but for every success, please offer your applause to my incredible team. Thank you once again for being part of this meaningful evening. I wish you all pleasant night. Thank you very much.
Thank you, Dr. Vasanthi. With that gratitude being expressed, we now come to the end of our program for this evening. I would like to make a kind request from the distinguished guests at the head table to take their seats in the audience for our next event to take place. in detail to what we are going to witness. It is a traditional dancing item to evoke blessings to our nation to inspire energy for revival in this challenging time. Ladies and gentlemen, please put your hands together for their performance.
Ayubowan, the traditional greeting of Sri Lankans.
Thank you for the orchestrated performance. Ladies and gentlemen, with that, we conclude the inauguration ceremony of 30th Annual Conference of the Sri Lanka College of Sexual Health and HIV Medicine. The ceremonial procession will leave the hall now. Please stand. Well, ladies and gentlemen, thank you for your presence here today, and we do hope you will have productive and fulfilling days ahead at our sessions. We warmly invite all of you to join us at the cocktail reception now. Thank you and have a nice evening.